Hello and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwarz, licensed midwife and MC here at Gold. And here I am so excited because we're getting ready for our Gold Midwifery Conference of 2025. And with me here is Nichole Wardlaw. Welcome, Nichole.
Hello, glad to be here.
It's wonderful to have you here. You, of course, are a speaker for our add-on package for Birth and Beyond Navigating the Unexpected Lecture Pack. That is part of the Gold Midwifery Conference this year, a brand new package. And your topic will be addressing umbilical cord complications from knots to prolapses. Oh, there is a lot to talk about, right, Nichole?
Absolutely. Lots to talk about there.
Lots to talk about. Before we jump into this, tell us a little bit about yourself. You are, of course, a midwife. And tell us about your work a little bit.
So I have been a midwife since 2005. So I'm in year 19 of this whole birth world. I was a teacher and then decided to become a midwife. So that's what I've been doing. And now I have circled back to being an instructor. So I am the midwife who does all of the mentoring and the teaching, and I love it. Education is my first love. So I feel like growing more midwives and teaching them is a part of my ministry. I have a practice in the Hampton Roads section of Virginia here in the good old USA. It is Jami Birth and Wellness Services. It is an out of hospital practice. I've been doing this for the last 4 years now. I transitioned from hospital only birth to home birth. And that's pretty much it. That's what I'm doing these days.
Wonderful. Thank you so much for sharing that. And yeah, it sounds like you found that perfect match there for you. Your background in education, now midwifery, and now teaching and bringing in new midwives into the field, and also then your home birth practice, of course. Now, let me ask you this. When you have a home birth and you have a transfer, that must be very helpful to you that you have a background in, hospital birth, because you can prepare your client what's coming next. Also, you probably still have good connections in the hospital, maybe where you've possibly worked before. So give us just a little tip to our other home birth midwives with regards to transfer. I know it's a little bit beside the topic, but it's so nice to have somebody who does both, who has done both the hospital birth and home birth situations. So give us a tip. What do you think is important if you're transferring somebody in from a home birth to the hospital?
So for me, communication is key. Not waiting until the very last minute. That if you anticipate that this is going to be a transfer, or that there are signs that mom is not doing well or baby is not doing well and we're going to need to do a transfer, prepare your client for this possibility. And then when you are doing the transfer, communicate with the oncoming service and give them all of the information. Make sure that you have good records. Make sure that you give what we call SBAR, which is giving the situation, the background, your assessment, and whatever the recommendation that you had from your birth at home. And then be willing to work with the oncoming provider, because sometimes they may need to add some other interventions that, of course, you do not have at home. If we have a prodromal labor, mom is not progressing, she's been ruptured for 24 hours, she may need some Pitocin. And so prepare your patient to say, listen, you may need Pitocin to get you going. And then when you talk to the oncoming provider, give them the full situation. Let them know what's been going on so that they can be prepared for what they're going to be taking in, because they're going to do their own assessment. But it's always good to have some type of background information and accurate records. That is so important. I cannot tell you how many times you get a client in the hospital and there are no labs, there's no imaging, there's all of this, all these pieces that are missing. So I feel like if you have all of those pieces in place, then your transfers can be seamless.
Wonderful. Thank you for that tip. Thank you. It's very much appreciated. And since your presentation is about complications, cord complications, not every cord complications words a transfer, but we have to be prepared for this. So it's very, very good. So tell us a little bit about your topic of cord complications. There are many and there's a lot to talk about. So give us a little bit of an overview here.
So I talk about everything from true knots to cord prolapses, short cords, long cords, nuchal cords, anything that has to do with that umbilical cord and what could happen with it. We have very simple, some things that are just incidental findings. So we talk about that, and then true emergencies and how you manage it. So when the incidences are, management styles, all of that are included in that presentation. But it's all about the umbilical cord.
It's all about the umbilical cord. Love it, love it. And I know you will be showing some great pictures with that, some images, which are helpful in following along and learning. So it's going to be a fantastic experience. So glad to hear about that.
I'm excited.
So before I let you go, Nichole, are there any wise words for our audience when it comes to the topic that you want to share at this point?
So I always say the one thing that this is just a midwife jewel, listen to your client. If your client has some type of intuition that says that something is not right, listen to them, because they are going to know way more than what we will ever know. And there's always something that's going on that we may have missed, and it reveals itself later. But we don't want it to reveal itself in a bad way. We want to see it when everything is all good, right? So listen to your clients.
Oh, I love that. I love that. And we always think as midwives we do that, but sometimes, we are also in this teaching mode and information giving mode, right? Like we want to prepare our clients for everything that could possibly be, and we want them to have the best birth possible, and also for the baby. That often I feel like, and I include myself in that, we give a lot of information when that which is important, of course, but really listen to the client and really, taking a step back and just listen and going a little bit deeper in that. Yeah. So that's a very good reminder, Nichole. Thank you so very much. It was such a pleasure hosting you here today and talking to you about the wonderful work you're doing and the upcoming presentation here. Thank you so much, Nichole.
Thank you. It was my pleasure. I appreciate everything, and I'm glad to be here.
Wonderful. And also information for our viewers. This presentation addressing umbilical cord complications from knots to prolapse is part of our Breath and Beyond Navigating the Unexpected lecture pack. And that is the add-on package for our midwifery conference of 2025 here at Gold. If you would like to find out more about this presentation here from Nichole and all the other presentations in the add-on package and the conference, we invite you to go to goldmidwifery.com to check out the program. All the presentations will be live and recorded of the conference. The add-on package is recorded, so you can watch that at your convenience as well. Thank you, everyone, for watching, and I hope to see everyone at the conference. Bye-bye, everyone.